This solution is commonly used to treat a range of bacterial infections and to prevent bacterial endocarditis in patients with certain heart diseases who are undergoing surgery. It is a natural penicillin antibiotic that works by halting the growth of bacteria. The recommended daily dosage and optimal timing for taking this medication should be determined by your healthcare professional based on your specific condition and medical history. This medication is given by injection into a vein or into a muscle. Use exactly as directed by your doctor. The dosage is based on your medical condition and response to therapy. For children, the dosage is also based on weight. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Give aminoglycosides, such as gentamicin, separately from this medication. Do not mix together in the same fluid. For the best effect, use this antibiotic at evenly spaced times. To help you remember, use this medication at the same times every day. Continue to use this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Tell your doctor if your condition lasts or gets worse. If you experience pain, redness, or swelling at the injection site, it's important to let your doctor or pharmacist know. However, many people using this medication do not experience serious side effects. If you experience joint or muscle pain, muscle weakness, swelling of the ankles or feet, dark or cloudy urine, extreme tiredness, irregular heartbeat, signs of infection, easy bruising or bleeding, signs of kidney problems, numbness or tingling in the arms or legs, seizures, uncontrolled movements, or confusion, it's important to contact your doctor immediately. If you're being treated for syphilis or other spirochetal infections, such as Lyme disease, this medication may cause a reaction known as Jarisch-Herxheimer. Notify your doctor right away if you experience symptoms such as fever, muscle pain, worsening of skin sores, fast heartbeat, fast breathing, dizziness, or flushing. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor if you experience persistent diarrhea, abdominal pain, or blood in your stool. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth or a change in vaginal discharge. If you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before starting this medication, make sure to inform your doctor or pharmacist about any allergies you may have, especially to penicillin or cephalosporin antibiotics. This product may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's crucial to inform your doctor or pharmacist about your medical history, especially if you have asthma or kidney disease. It's important to note that penicillin may interfere with the effectiveness of live bacterial vaccines, so be sure to let your healthcare professional know if you are using penicillin before receiving any immunizations or vaccinations. Some forms of this medication contain sodium, so if you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, such as heart failure, consult your doctor or pharmacist. Similarly, certain forms of this medication contain potassium, so if you are taking potassium supplements, salt substitutes containing potassium, medications that can increase potassium levels, or if you have a high potassium level, be sure to consult your doctor or pharmacist. It's also important to note that older adults, newborns, and infants may be at a greater risk for side effects while using this medication. If you are pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with penicillin Gk-Iso-Osm dextrose solution, Piggyback Premix frozen, as they can impact how the medication works and increase the risk of side effects. Always keep a list of all the products you use and share it with your healthcare provider. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include blood thinners, such as warfarin, methotrexate, NSAIDs, such as aspirin, indomethacin, tetracyclines. If you are prescribed low-dose aspirin for specific medical reasons such as heart attack or stroke prevention, it should be continued as prescribed by your doctor. It's important to ask your doctor or pharmacist for more details. It's also important to be aware that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much penicillin Gk-Iso-Osm dextrose solution, Piggyback Premix frozen and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and changes in mental or emotional state. Your doctor may order lab tests to monitor your kidney function, complete blood count, and potassium/sodium levels while you are using this medication. It's important to attend all of your medical and lab appointments and consult your doctor for more details about these tests. Make sure to take each dose of this medication as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for guidance on when to take the next dose. It's important not to take a double dose to make up for the missed one. Remember to consult the product instructions and your pharmacist for storage details, and always keep medications out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.